John, Scott, thanks for taking the time to sit down with me today.
Thanks, Joe. Great to be here again.
Yep. Thanks for the good bash last night. Right?
It was fun.
Ian
It was
White
fun.
at the top of the CN. Does anybody know what CN stands for?
I think it's Canadian National for
okay, there you go.
Railroad.
I kept on calling it
Yeah.
the Space Needle, and I got.
It was an incredible view. A little scary going up, but it was worth the ride. Thank you.
It was.
Yeah.
Scott, great being back together again. Good to be here. So we're here at the AdvaMed conference, and this is a subject you and I, well, three of us have thrown around so much that I'll say it, I think could be one of the most important aspects that's under discussed in MedTech today. AdvaMed conference is meant to, by Scott and the team, cover the subjects that are critical that are occurring today, whether it's pay, reimbursement, law, but let's talk about the elephant in the room, the lack of dialogue going on around ambulatory surgical centers. And I know that you have been in that space, and you and I have been chiming about it for 5 years from the sides of the stage, and you and I have discussed it as well. But
Correct.
Scott, ASCs, their impact on the medtech industry, and even the people who sell into it, who are selling billions of dollars.
Yeah, and Joe, I appreciate the forum and the opportunity to talk about this. And what was so validating professionally over the summer was it wasn't Joe Mullings and Scott Fraser talking about it. It was the advisory group published the top trends in medtech this coming year. ASCs being, I believe, the number 4 trend, and private equity-owned MSOs being the number 3 trend. And when you think about it, the two are very much intertwined. It's one major trend, and the trend is what providers, payers, and patients are gravitating towards. It is a more efficient, lower cost site of service. And more importantly, I think as you see a comfort level with providers and the safety data coming forward for higher acuity cases, total joints, cardiocath procedures, ablation. And it's great to hear a lot of the cardiology companies right now talking about the multi-billion-dollar opportunity with cardiac ablation in the ambulatory center. So the industry is saying the right things. I would argue the alignment is not quite there yet. And I know I've worked closely with the EY team on private equity transactions, and so much of a private equity transaction is built on the ASC thesis, meaning we purchase a group of 10 orthopedics, we move them into an ASC, and that activates a whole new revenue stream from a facility standpoint, but the ancillaries that surround it. And it is at the core of any PE thesis to invest into a medical group is build them an ambulatory center or find an ambulatory center that they can operate in.
And John, your perspective with E&Y, and you always have a phenomenal perspective on the industry at large.
Yeah, I think, hearing some of the CEO panels here at AdvaMed, they're highlighting the need for more cases to actually transition to the ASC. And even our firm now is offering, one step further, medical care that used to be in the hospital, like in your home. And so several of those companies have actually been backed by some of the larger providers, the Kaisers and the Mayo Clinics of the world, because they even realize that, hey, we make a lot of money by doing medical procedures, and those are not only moving into the ASC, but those are also migrating into the home. And so I think it's been, quite insightful to hear some of the commentary from CEOs, acknowledging that trend, embracing that, fully validating that reimbursement will follow. I think that's been, one of the hurdles, but it seems like that is now transitioning. COVID has been a, large contributor to thinking about care delivery in a different way towards less acute, more cost-efficient scenarios, and I think you're hearing really a sea change, especially with the constraints within the provider environment that are really kind of now forcing some of this care setting to really migrate into the ASC and into the home.
And as we get more and more adept at diagnosing things, and we've got an aging population, let's just keep on doing the math here,
Yep.
right? And we're getting a higher fidelity of treatment on patients, and we're also requiring certain step changes in that therapy. So we're actually introducing even more procedures in order to get diagnosed and treated in some cases. The changing centers of care at home and the ASCs, we already have an HR problem, a head count, a human personnel problem.
Yep.
And the ASC world is different than the hospital world.
For sure.
I'll say it here. There's people who go to work at strategics in medtech, and there's people who go to work at startups in medtech. And the people at strategics don't do real well at startups. And startups, Mavericks, don't do real well at the strategics.
Yep.
Same thing with hospitals. Hospitals get a certain kind of employee. ASCs get a totally different employee. Yet, for the most part, nobody's worrying about how are we going to fill those ASCs up with headcount.
Yeah, one of the real limiting factors right now, and I think it's on the investor's mind constantly, is what's happening with healthcare labor. And the stats are staggering with the shortage, you name the subspecialty, the shortage of providers that we have. But I think more crippling right now is all the support staff around them, the nurses, the PAs, the technicians, the CRNAs. I have a good friend who runs a large MSO and was joking that the CRNAs in his local city are like mafia trash collectors. You got to pay them to show up on top of what he's already paying them, for their contract at the ambulatory, just to show up to work each day. And that is only going to continue to compound itself. So it's a real limiting factor right now. And, frankly, it's all of our problem. Without healthcare providers, this industry and the growth of this industry is constrained. But I think selfishly, all of us, as we age, who's going to take care of us? So I look at what can my firm do and what can all of us do to help our providers with recruiting, to help them with education. Some of these MSOs right now that are private equity backed are doing mentoring programs for high school kids. That is a real long-term investment, but with the goal that they are eventually going to get some professionals that will go through training that otherwise weren't selecting a healthcare profession. And I think it's time the industry thinks differently about practice building, the compliance side of things, because there are ways to stay compliant and at the same time help drive recruiting for healthcare workers.
Yep. John, what do you think about the large strategics and the mid-caps? Are there current constructs of their commercial go-to-market clinical support teams built for that, I'll call it guerrilla warfare, because you're gone from taking a war on a hospital, a big brick building in the middle of a city, now to these ASCs that are scattered around the same geography.
Yeah, I would say you're going to see a high degree of variability. Some companies are really setting up for that transition. I kind of go back to the analogy in diabetes. If you go back 5 years ago, it all went through DME or durable medical equipment. Then the novel idea came, hey, why don't we make it more patient friendly? Let's go through the pharmacy. And that was a real sea change, and companies weren't set up to do that. And so they had to reconfigure, they had to retool, they had to bring on new capabilities of really transacting to do business through the pharmacy. And so, I think, again, as you look at the ASC, there are certain companies that are gearing up for that arms race, that transition, and there are other companies that are not. And so, I think one of the other things when you talk about workforce is, we made it all the way to the second question without mentioning AI, and so maybe I'll bring it up now. But it's interesting, as I look back a year ago, AI was really a buzzword, here. most of these CEOs of the large companies went to Davos and got religion that AI was going to change the world. So they came back and kind of challenged all their lieutenants to what are you doing now, what are you going to do in the future, and what are the outcomes? Those are the three questions that everybody got. And I think, coming here this year, it's really been a sea change where you're seeing, I would say, kind of three, kind of areas where genuinely MedTech is deploying AI. And the one is on the product side. You're seeing it now embedded in products like robotics and establishing no-fly zones. You're seeing it, enterprise-wide, like going in, establishing new products, especially in diagnostics. I mean, we're seeing a lot of AI really embedded in that side of new therapies, new diagnostics being introduced. And then the last one, which is probably most impactful, is the whole workflow management. You can't go in any of the CEO conversations without hearing about, hey, we're going to improve workflow management. So you think about in the field of radiology, I mean, almost all these are being done now vis-a-vis AI. And so that focus on workflow management is, I think, going to be one of the enablers to free up additional resources. And it's really that back office, kind of mentality that I think MedTech has a real opportunity to bring to the provider world that hopefully maybe frees up some additional resources. And I know there isn't a company here, including our own, that isn't looking at, how do I do procurement better, faster, cheaper? How do I do commercial better, faster, cheaper? And how do I embed AI to automate some of those, manual tasks that are, allows me to free up and focus on the 20% that really matters.
Yeah, it's really interesting in straddling the work with PE clients and MedTech clients. And why I say that is what PE firms are looking at for their large MSOs is driving organic growth, because it's very hard and very costly to go out and acquire new groups. It's also very hard and timely to require new physicians. So a big theme with organic growth is having providers work to the highest level of their degree. And you look at some of the AMA data on physician burnout. The number one driver of physician burnout or provider burnout is click fatigue. It's the manual process. And I think what's really refreshing right now is the collaboration that's finally happening with large healthcare service companies like an HCA, folks like Oracle, and other major tech companies of saying, what can we do to empower workflow to allow our providers to focus on a patient? Yeah. And just spending a lot of time in Nashville, and if you haven't been in Nashville recently, it's amazing what's happening to the healthcare city, which was the music city, and now it's the healthcare city. Yeah. And the excitement and collaboration about big tech moving in, being Oracle. And what Oracle is trying to create with an ecosystem around healthcare management companies to really challenge Epic, but more importantly, challenge the whole ecosystem to help our providers. And it's exciting because I think this isn't going to be one company that solves this. It's going to be a collaboration with a lot of different companies, and MedTech needs to absolutely be part of that.
Let's get tactical down to the MedTech side. When I think about now moving my business from calling on a hospital with my sales force and the products even that I put in there, right? Because we're starting to see the stratification in categories like robotics, where mid, high, and low complexity, right? Mid, high, low acuity cases. Right, we're going to push those by design out to the ASC, so devices are being designed for that. Then you got the supply chain, because you don't have an inventory like you have in a hospital. Then you got the service. You don't have the same service as you do in a hospital. And then you go the sales force, right, touching base with all those. So all this workflow is going to have to change in the MedTech industry if you're going to be on the leading edge of that industry. But if you're not, are you going to be stuck losing out to an Intuitive who went all in on ASCs, like Intuitive went all in on large format robots, created such a gap between the number two player. There isn't even a number two. So if you're a striker and you triple down on your ASC effort, and I'm just using them as an example, I think Lobo's the one right now who's doing it the best out of the strategics. If you really double and triple down on that and start to own that ASC model, what's going to happen to the people who aren't doing that?
You know, I think the best example was something a mentor told me years ago. And he's like, with as any leader knows, is if you want them there for the landing, involve them in the takeoff. And you know, you think about that, and when a group of physicians want to build an ambulatory center, when they incorporate with the idea, they form, you know, their own legal entity, that's when Medtech needs to have a seat at the table to help them design their facility, you know, for operational flow. You know, a lot of times when you go into ambulatory centers that are de novo projects, it was designed by an architect that maybe a physician had redo his kitchen. Right. And no joke, I mean, that's like sometimes what you see out there.
Or they did a dentist office.
Yeah,
downtown, right?
and not understanding the workflow and the easements that are needed and what have you. And Medtech has a lot of value to bring there. But where you don't want to be, and I would say for the large strategics that aren't involved in the builds of an ambulatory center, or right now one of the big trends is how do you build out capacity in an existing structure, so adding a new room, what have you, you're fighting for scraps in the RFP process. And that's where that bias is, all ASCs care about is price. You know, there's a reason why you want to be involved in that build, is price is part of the equation, but it's not all that goes into that equation. And once you're in, you're a vested partner in providing value to these ASCs.
And maybe just one thing to add on to that, Joe, because I found it really interesting. I just sat in a supply chain panel, and managing customers is different, right? And so I've heard it before, but I heard it in the panel. You know, it always used to be you plan, you make, you deliver, right? And then Medtech kind of washes its hands. And most of that all takes place manually, by the way. Now they're talking about automated solutions and a fourth vertical, customer solutions. Mm-hmm. So really thinking about that last mile, how do I manage that customer from a supply chain perspective, okay? And once you get to that level of planning and it's automated, you can manage a lot more effectively hospitals, ASCs, the home. It doesn't matter, because they're all going to be on the same electronic platform. And so, again, some companies are making those investments. They will be much better suited to really implement that change and really deal with it, because they're already going to have customer solutions that are really bespoke to their individual customers.
Yeah, and it's a really good point, because surgeons are notoriously terrible businessmen. I mean, notorious. And so why there's not a university, an ASC university in each of the large strategics that is a service provided for free for the goodwill that you will then, you know, earn later, and be able to put more of your devices in there. So I don't know, it might be too basic of a principle, but.
No, it is, and you know, getting back to the labor shortage and working to the highest level of your degree, unfortunately a lot of times in ambulatory centers is what you see is one of your highest paid staff members, your nurse manager or your business manager, is the one who's doing all the ordering and the inventory requisitions, and it's
on a scratch pad.
Yeah, it's such a waste of resources. And you know, how do you look to automate that? I mean, it's amazing that most of these strategics, if you look at their customer care centers, still do paper faxes and phone calls for orders. Yeah. And it's like you look at every other area of our transactional life, and it's all electronic.
Yeah, it is changing. I think there'll be certain companies that'll be better prepared to make that leap.
So closing question, John, I'll start with you. What is it over the next 12 months that you're going to be looking for signals from the market that the medtech companies are getting it in the ASC world?
I think hopefully we will see some of the noise and the news, frankly, about non-elective procedures being shut down, obeyed, that there'll be better service requirements, that there'll be more resiliency built into it, but also that we'll hear less about capacity being an issue. Now, will we hear that over the next 12 months, or we hear a worsening of the situation? I feel like we're going to hear more worsening of the situation, unfortunately. But also that news of more transition to the ASC, I think would help alleviate some of that capacity issue within the acute care providers.
It'll be interesting too, because every surgeon you ask is miserable being an employee of a hospital. Every
For
single
sure.
one of them.
Yeah.
Right?
Yep.
Sorry, hospital, but they are miserable. What signals are you going to be looking for that will tell you that we're starting to get traction, other than Scott Whitaker allowing us to have a panel on ASCs next year? Sorry, Scott.
Next year we'll have that. One of the things that I have come to appreciate more and more is who's at the top of the food chain. And very simply, there are three major entities. You have large self-insured employers right now that CFOs and boards are grappling with 8+% increase in health insurance next year. You don't think there's major board discussions going on right now? It's only a matter of time before you have a consortium of these large self-insured employers led by CFOs that are public companies and have a responsibility to look at a disruptive health plan. Disruptive health plans will look to contract directly with providers, and providers that can demonstrate quality and a lower cost of care setting for elective procedures, for instance. I also look at where private equity is making bets. You have multi-billion-dollar funds that are doing incredible research on site of service shifts. And you look at the excitement around cardiology investments right now, and it's a little bit different of a cookie cutter approach that they took in a lot of the other ologies, because you got to bridge these cardiologists that are 80% of them are employed by hospitals out of employment, out of a contract, bridge them with their income and build them an ambulatory center. But I think when you start to see major self-insured employers, unions, push back on traditional hospital-based cost of care, coupled with the private equity investment into higher acuity type setting, higher acuity cases in an ambulatory setting, that's when I think the medtech industry will wake up. And it's interesting, you talk to some of the larger medtechs, and a client that we were trying to work with getting a direct to provider contract so they could access their technology in a network of ambulatory centers. And the benefits group at this employer couldn't figure out, it wasn't a priority. And it was mind-boggling. I was like, you want your employees to have the best possible technology, and it's in a network of ambulatory centers that surround all your covered lives, and we couldn't navigate through it because of the insurance companies. So,
well, again, a misalignment of incentives in the healthcare industry at large once again. Well, gentlemen, I appreciate it. I mean, this is a subject that I think will be taken front and center, because it impacts patients, payers, device companies, revenue, stock market, and breaking our country when it comes to healthcare costs. So, appreciate your time.
Thanks, Joe.
Thanks, Joe. Take care.
I'm Joe Mullings from the floor of Medtech Conference, Toronto 2024. Be well.